Good day. Today I would like to present the review of existing methodology on blood carbon monoxide determination. Circulatory system is a system that allows blood to circulate through various parts of the body. Blood circulates through the body for transport of nutrient, oxygen, carbon dioxide and waste product to and from the cell. Oxygen entering the blood binds to the hemoglobin in red blood cell, also known as RBC, before it is transported by the blood from the lung to the capillary level by passive diffusion. The insufficiency of red blood cells to maintain sufficient tissue oxygenation can lead to a condition known as anemia. Carbon monoxide is an odorless and colorless gas that binds to hemoglobin with an affinity of 210 times greater than of oxygen. Inhaling this fume causes carbon monoxide build-up in the blood cause of carbon monoxide poisoning by combining with hemoglobin to form the carboxy hemoglobin. The symptoms of carbon monoxide poisoning such as flu-like, headache, dizziness, vomiting, and chest pain. The late treatment of carbon monoxide poisoning can lead to a serious tissue damage and even self-death. The current treatment available is breathing in pure oxygen through a mask placed over the nose and mouth. The second is hyperbaric oxygen chamber therapy to speed up the replacement of carbon monoxide with oxygen in the blood. The invasive technique available now is arterial blood gas analyzer. It is usually used for measurement of arterial gases. It also gives the information on the amount of hemoglobin, oxyhemoglobin, carboxyhemoglobin, and also blood oxygen saturation. A small volume of blood to be drawn from the radial artery using a syringe and a thin needle. The sample was sent to the laboratory before it is introduced into the analyzer. Previous findings show there is no significant changes in carboxyhemoglobin level in the sample stored in the refrigeration and at room temperature over a period of 28 days. Lim discovered that there is hemodynamic instability due to increase of carboxyhemoglobin. High measurement of accuracy from carbon monoxide rebreathing method is discovered by Sieberman using ABG analyzer. ABG analyzer is recognized as a gold standard for carbon monoxide detection due to its high accuracy. The limitation of the ABG is strict procedures should be followed during its storage, handling, and transportation. Non-invasive techniques such as magnetic resonance imaging is used in radiology to generate image of an organ in the body by the use of strong magnetic field and radio wave applied to the subject. It provides the high resolution and accuracy at the price of long scanning time, noisy environment, and patient will feel discomfort from lack of movement, and it also not suitable for the patient with phobic feels or with metal implant. There is a strong correlation between carbon monoxide poisoning level and formation of cerebral white matter lesion on image and mental health change using magnetic resonance imaging. Although it offers comprehension and more detailed information pertaining the effect of carbon monoxide poisoning on human body, it is limited to inconsistent of MRI image quality. Next, computer tomography. Computer tomography uses the X-ray to build cross-sectional image of the body based on the tissue density dependent absorption. The attenuation of the transmitted X-ray beam are recorded and processed using mathematical algorithms to produce tomographic image. Previous findings show there is association found between blood carbon monoxide level and globulus pallidus and cerebral white matter. It offers high imaging specificity but limited to the resolution. Gas chromatography is used to separate chemical components of a sample in identifying its constituents. The analyte required to be volatile, dry, and free of solid. The correlation found between the major peak signal and carboxyhemoglobin concentration up to a precision of plus minus 0.02 at 0.2 atom per cent SS level. It is suitable for routine analysis of large batch of sample. However, the reduction of carbon monoxide to methane is required before the detection by the flame ionization detector. This approach also has limited detection resolution. The next non-invasive technique is spectroscopy. This technique is for the investigation and measurement of spectra produced when the investigated matter interacts with or emit the electromagnetic radiation. The typical spectroscopy system allows light emitted from a light source to pass through the sample. The transmitted light are detected by a detector. Previous findings show a slight bias was found as compared with the ABG, indicating a slight overestimation by the pulse carbon monoxide oximeter. It provides a rapid measurement while the measurement is affected by pigmentation and ambient light. Measurement may also have high false positive rate. Photoacoustic imaging is a measurement of acoustic wave produced following the absorption of electromagnetic energy by an absorbing center. The produced photoacoustic spectrum of a sample can be recorded via a transducer following its exposure to different light wavelengths. It's mainly divided into three stages, which is optical absorption, thermal expansion, and also acoustic wave generation. The previous study reported on high imaging resolution and good accuracy in carboxyhemoglobin saturation detection. It's able to produce high resolution image without the aid of contrast agent. However, the accuracy of the photoacoustic system is subject to the illumination pulse rate. The comparison between the invasive and also non-invasive system was the sensitivity of magnetic resonance imaging is greater than CT scanning. MRI and CT scan are often require the use of contrast agent to enhance the resolution. However, the contrast agent might cause of allergy, including of skin rash, redness, and swelling. The invasive device such as GC and ABG is fairly accurate, however, be time consuming, especially in sample preparation, and the surrounding temperature may also affect the result accuracy. Optical spectroscopy such as pulse oximeter and pulse carbon monoxide oximeter is the measurement of chromophore concentration by passing radiation through the sample. High false positive rates are often reported in pulse oximeter if carbon monoxide presented in the sample. Low precision and accuracy reported in pulse carbon monoxide oximeter is able to accurately detect the hypoxemia in humans with elevated carboxyhemoglobin level. The hybrid of optoacoustic spectroscopy using photoacoustic spectroscopy (PAS) reduce the complication arising from very dark material or highly light scattering sample. Their profiling information on structural specimen is also reported. Feasibility using the adjustable probe depth of photoacoustic spectroscopy system. The future direction included photoacoustic imaging is suitable for blood carbon monoxide detection. Photoacoustic system for in vivo investigation of carbon monoxide using at least 3 visible light wavelengths is included in the future. One of them will become the isobastic point to remove the effect of skin pigmentation, while the other two are those that are sensitive to hemoglobin component concentration changes. The change in blood carbon monoxide level may be differentiated via the difference in their photoacoustic signature. Deep learning, which is the convolution neural network, may also be adapted for prediction of carbon monoxide poisoning severity using photoacoustic imaging signal in future. That's all from me. Thank you.